You're listening to Psych with Mike. For more episodes or to connect with the show with comments, ideas, or to be a guest, go to www.psychwithmike.com. Follow the show on Twitter @PsychWithMike or like the Facebook page @PsychWithMike. Now, here's Psych with Mike. Welcome into the Psych with Mike Library. This is Dr. Michael Mahan. I'm here with both Brett Newcomb and Dr. Carrie Lewis.
Yeah, everybody's a doctor but me.
Does that make you feel left out?
Lucky.
You're the oldest.
Yeah.
So
I'm the oldest. Yeah, back in the day, they didn't have to have
one, right?
That's
Well, and you figured out how to have a better life than we have and not be a doctor. So
I used to teach anthropology when I was teaching high school, and we would have conversations in class about the quality of life differences between primitive cultures and advanced technological cultures. When they figured out that in the primitive culture, the average adult spent maybe 20 hours a week working to survive, and the rest of the time doing whatever they wanted to do, versus the technologically advanced culture where you spend 120, 160 hours a week working to survive.
Right.
They were not so sure that we were the better, higher organized society.
I don't think there's any question that we're not. I mean, you see
studies about how much stress level we're all under and how that's affecting us.
We all talk about how great email is, but there was a concomitant
I need to check
raise.
mine right now.
Exactly. People would go on vacation; they couldn't be connected to their email. Whereas before, when phones were connected to a wall and mail came through your mailbox, you go on vacation and you didn't have access to the rest of the world.
My youngest son is 24. He's an engineer. He went to work for a company that said to him, when you go home, do not check your email.
Yeah.
You are off the clock,
But
and we can tell if you check in.
How rare is that?
And we will stop you.
Yeah.
So that's a great thing.
Except for if you say we will check you, it's like, best believe I'm going to go. But that's just my own oppositional nature. But I agree that.
So have you always had troubles with oppositionality?
I think so.
It's a personality characteristic that's pretty
She just wants to be interviewed. She doesn't want to be therapized.
I'm sorry.
Oh, no, well, but it's true. I'm pretty good at hiding it. People think, oh, you're good.
Well, I recognize a kindred soul.
He can't help himself. He wants to do therapy with everybody.
No, I'm oppositional.
Oh, that's what it is.
Oh,
gotcha.
yeah.
Okay, I got it.
I hate authority and rules that are not mine.
So we've had Carrie on the show before. We talked about the fact that she actually went through the Webster program, Webster being a university in St. Louis where you and I live, Brett, and have both taught. We established pretty clearly that I was her favorite.
I don't remember it that way.
Pretty sure that's what happened. Yeah.
Have you always been delusional?
No. You know what? You know why I say that? Because I feel horrible in good self-disclosure, because you've always said that my one primary trait is that I will throw myself under the bus, even when it's to my detriment. And you don't remember saying that?
No, I'm trying to think, why would I ever say that?
Oh, you've said it to me a couple times. But
it's probably what he heard, but not what I said.
That's definitely what I heard. I feel bad because we did an entire episode with some really, really bad feedback that ended up rendering it useless for us to be able to post, and I feel horrible.
And by feedback, you mean electronic feedback, not comments from the audience.
That's right.
Yeah,
that's right. Yes, electronic feedback. That is correct. Yes. Yeah. So I feel bad now. I'm trying to compensate for that.
All right.
By tooting my own horn, so to speak.
In therapy, I would say, how's that working for you?
Not well.
Okay.
Yeah. So.
What would you
it's like it's been going okay.
But Carrie, your actual area of expertise is working with children, and so we wanted to talk about that.
Which is why you're going to be so good with us today.
Right. Yeah. Yes, because we are the infants in the room. So tell us a little bit about your work with kids and what that looks like.
Yeah, so I started working with kids actually as an undergrad doing applied behavior analysis. So behavior therapy with kids with autism. So I did in-home, in-school type stuff and social skills classes. And that's what I was doing when I started Webster.
And I can hear all of the behavior analysts in the audience saying, yay! Because people don't really know a lot about that, but there are people who that's their job. They work as behavior analysts with kids in schools all the time, and their job primarily as a behavioral analyst is to do what?
So again, I worked with younger kids with autism, and so it was through first steps, so 0 to 3. I did work with older ones as well, but it is to help with language acquisition, with some of the behaviors of autism that can cause problems and does cause problems for people, helping reinforce more appropriate and adaptive behaviors and teach the families to do accordingly and how to respond to certain behaviors. And so behavior therapy works in every aspect of life, but specific for kids with autism, stereotypical behaviors that maybe make them stand out socially and limit their opportunities, or their fixations with certain topics and not having reciprocal
like railroad
conversations.
schedules or train schedules, or cars, or baseball games, baseball statistics. I mean, some of them become so minutely focused on it, and they can recite data back for years and years and years.
Air conditioners. I had a kid who loved his air conditioners.
Wow.
That
is incredibly
I had a kid one time who was in
esoteric.
the 8th grade, and he was a chronic snot sucker. And it was so disturbing behaviorally for his classmates and his teachers that they would immediately reject him. He got all these negative vibrations of unacceptability, even from the adults who were trying not to do that.
Right.
And when I worked with him, what I talked to him, I said, would you like to be popular? He's like, yeah. I said, do you understand why you're not? No. Because I'm not doing anything to these people.
Right.
And I said, okay, so we have to cognitively step outside of your awareness. You have to consciously learn to think about this and be aware of it. And if I can get your teacher to work with me on this, will you be open to that? And like, okay. So I said, I gave her a card, and whenever he'd start sucking snot and making noises with it, she'd flash a card. It was like one of those green, red, yellow light things. And he was amenable to that and began to make progress in not doing that because he understood. I said, they won't like you or want to be next to you if this is what you do.
And the visual cue was more helpful for him than the teacher saying, Johnny, quit.
Right. Yeah, they should stop that. And he didn't know what they were talking about. He wouldn't do anything.
And that reminds me of one thing I tell people is verbal prompts are the hardest to fade out, meaning that we get the most dependent on them the most quickly. And I've given people the example of, if you have a navigation system or on your phone, if you use it to get somewhere, you never learn to get there without it, because it's the verbal prompt dependence. So visual cues are easier to fade out over time. So that's another reason.
Well, and you can train the teachers and the parents to also do the same thing, whether it's holding up a red card or doing a 1, 2, 3, as opposed to saying it. They're teachers are typically more ready to say, well, that's 2, instead of just saying 2 and still doing what they're doing with other kids. So they don't call all the classroom attention to you.
Right.
And all those negative emanations of why are you disrupting or distracting.
But they have to think about it. What does that mean? So it takes some amount of cognitive processing to internalize.
Yeah, that individual child has to be taught that's what this means. And it's outside of what you're feeling, because they'll swear to damned, I'm not doing anything, pencil tapping or whatever it might be. So that's just one of the kind of skills.
And, one of the things that I'm very aware of, I do clinical supervision for what's called an EAP, an Employee Assistance Program. So we do a lot of in-house work. We're one of the very few EAPs that has a staple of in-house therapists. So we try and see people one-to-one locally to the greatest extent possible. And one of the things that we always struggle with there is how young are we going to treat somebody? Because people want to have their children diagnosed and treated. Now, I would argue that is oftentimes more indicative of a systemic problem in the family, but a lot of people say, hey, my child has an issue and I want to get that fixed. So people who do therapy for a living, not a lot of people want to work with children under the age of 12 because it's harder to get them to sit still for 45 minutes and actually do talk psychotherapy. So for somebody who...
But they also don't have the power in the system, usually.
The kid
child does.
Right.
So if you get therapy with a child...
I know.
Yeah.
Right, and which is great for the system because the system can put heavy emphasis on keeping the child broken. Right, and no matter what you do, they can try and undermine all of that work and then say, well, it's you. You're not doing a good job with this kid. And you're like, well, you're...
So So that goes back to the conversation we were having earlier.
Yeah.
I think that it's really important to work with the families of the child. And you, in our off-camera conversations, we're talking about your approach to being able to do that. And so could you walk us through that a little bit from your perspective?
Yeah, and kind of getting back to a couple things you guys said. So even though autism and behavior therapy is my background, I would say it's evolved over time, and so that's still foundational, information that I use, but being much more allowing in certain circumstances, such as autism, when it's not a systems thing, it's a biologic thing. That's one form of treatment, but I've gotten more into trauma and things that are systemic. The system is broken, and so working with the families and being integrated into their lives as much as they will allow and over time. And so things like in-home therapy is something that I plan to offer because, one, you get so much information that's so rich about the family dynamics, but also being in an office exclusively once a week or whatever with a client, it's not enough of what's really going on for me to feel like I can get deep enough. And so different people have different viewpoints about that. But that's one way of kind of becoming part of the child's life and building a real relationship, but also with the families.
The psychiatrist Milton Erickson used to do a lot of that kind of stuff, taking a walk with a client.
That's exactly.
A bike ride, or going to the home.
Yeah, so we, being in the community, bike riding, I collect fossils, and so now some of my clients, whether they really want to or not, we go looking at rocks, and so it's partially, as we were talking about earlier, because when you're focused on something else, your defense mechanisms are not as active, or you're not as self-conscious about what you're saying. And so that's ideal, but then also seeing a person in different settings gives you more information about them while also building the relationship.
So I think one of the most important therapeutic messages to children, if it's true, is that you're not broken. You learn differently. We can figure out how you learn, and then we can find compensatory strategies that help you be more acceptable or successful in the mainstream. And I find that that's an important conversation to have with the parents as well, so that message to the child is reinforced, that you are acceptable, you are lovable, you are capable, you can do these things. Because they get so many messages from so many directions that they're not, and that they can't. Do you agree with that approach?
Yes, I think it depends on what the child's difficulties are. So sometimes that what they're doing is unacceptable, but they're lovable. A lot of times the kids I see, what they're doing isn't unacceptable, but it's not accepted.
So do you make a distinction between age-appropriate but unacceptable behavior, like 7-year-olds do this, 7-year-old boys do act out this way, or do you find that just the behavior's unacceptable or unaccepted within the family?
So both. I definitely consider developmental norms, and that's been a way of communicating with parents to kind of show them and talk to them about this. A 13-year-old or a teenager is kind of supposed to be a jerk. So to help them understand that this realm of behaviors and traits is typical and healthy, because that's getting them to the next stage. But also helping the child understand, as I gain their trust and understand what's going on, that maybe what their parents are doing or caregivers are doing isn't okay. And we're working on that. But I see you, I know what how you're trying to navigate this. And
So I remember my father telling me when I was in high school, it's okay if you want to be on the football team. It's not okay if you want to join the drama club.
Exactly. And so it's okay to want to join the drama club. You might not be able to right now, but yeah, then the relationship with the caregivers that's where it becomes so important, is for them to trust and know that you genuinely, like them, if you do.
So that's what you're talking about when you say that you're engaging in a behavior that is acceptable but is not accepted.
Right. Yes.
So they want to go and join the drama club, but the system says, no, you can't do. Another example would be if you wanted to express yourself appropriate emotionally, you wanted to cry as a child, but you were told, no, you can't do that.
Yep.
That's an acceptable behavior but not accepted in the system.
I remember hearing on a regular basis, you want to cry, I'll give you something to cry about. Was not acceptable.
Right. Yeah. And I think a lot of people who hear those messages aren't the ones who show up for therapy, because a lot of the clients I see it's not a choice necessarily at first. And
because
so,
their acting out has become so extreme, the system mandates it?
Because the caregivers are not wanting to face what their role is, and so they don't come until someone says, well, if you don't, you're not getting your kid back, or whatever it might be.
Right.
That's a portion of them, and then some Hooters don't really realize what they're doing. One thing I keep in mind is we're all doing the best we can, and I really truly believe that for caregivers and kids. So trying to emphasize.
So one of the challenges in working with children is the issue of confidentiality and the boundaries, because as a mandated reporter, which is someone who's required by law to report to the state if they see certain levels or kinds of abuse. If you hear about that in therapy, a kid says, my aunt came to visit last weekend and she stuck me with pins. And you have to decide, is that something I need to tell the parents about? Is that something I need to tell the state about? How do you work your way through those issues as a clinician?
So besides the standard, consents and things like that, and explaining the limits of confidentiality in your informed consent process, I find, if your aunt's sticking you with needles, it's not too difficult for me to say, we're going to do something about this right now, and we're doing it. But when I know that it's more gray areas, the ethical decision making, where
I feel real uncomfortable around my stepdad. He keeps looking at me in sexual ways. He hasn't touched me, he hasn't said anything, but I feel slimed. And I've talked to any number of women who say, I know when I'm being slimed. The guy hasn't crossed a behavioral line that anybody else can see, but I feel it. Would you agree with that comment? That women can tell when they're being sexualized and slimed,
yes,
inappropriately?
One of my biggest I'm a big proponent of trusting your gut, whether it's a woman, man, kid, is that too often we're told our gut is wrong, and it's not usually, even if it's part, and so.
But as a child, the power discrepancy is so huge that to say,
how do you
hey,
tell
trust
your mom?
your gut.
You go and tell mom, and she says, be quiet because we need dad to bring the paycheck home.
Well, and because they are your world, not only are they the adults who have control, but they're also what sustains you. They're also what made, and you don't think those things consciously as a child, but that's your world. And how are you going to think your world's wrong?
So you take your anger and you're acting out somewhere else, like school,
or
and you
inside.
act out there, or you put it inside and act out against yourself. So then you get to the issue of self-harm. How do you work with a child who's self-harming, whether it's an eating disorder or a cutting disorder or some other disorder, drinking, around the issue of confidentiality? If you're cutting yourself, we have to confront that. Do we have to bring the parents into it? Do we have to bring the school into it? Do we have to have resources marshaled to prevent a level of damage that you're not able to judge for yourself about? So then how do you get them to trust you if you're going to do that? If you tell them, I'm going to have to turn this in.
Well, and so to some of those things, cutting or substance abuse, part of it for me depends on my relationship with the family and the client. So if it's the first time I saw them, then my threshold for what I need to share and report is going to be much lower than if people are very actively engaged and I know they're coming back. And, I've even said to some that I think we can work through this right now, but if you just go MIA, so that threshold of something needs to happen. So therapy is likely what would need to happen, but if you just engage in therapy. So it can be gray areas, which is something that is very challenging. For example, I've worked with somebody who smokes marijuana, a teenager. We didn't discuss at the beginning what we were going to do with something like that. And so I've since, and I'm moving forward, will talk to caregivers about specifics. If they're, especially for adolescents, if they're smoking marijuana, this is what's going to happen. If it's something harder than marijuana, this is what's going to happen.
Right.
If they're
Right.
suicidal with a plan and intent and, can't keep safe, they're going to the hospital. So there's just sort of these different levels of, do I need to tell the parent? Do I need to call, the authorities? Do we need to hotline?
So do you try to make those hotline calls with the parents present if you can, or do you just do that on your own?
I definitely try to do it with the caregivers present.
Because I would try to get them to make the call themselves.
As well as, because I feel like if it really reaches the level of mandated reporter, obviously, not every mandated reporter in the world has to start calling, but I think one has to.
Well, and the state doesn't want you to. I know, for instance, as a classroom teacher, we were told the principal or the lead counselor will make these calls. But the teacher is a mandated reporter.
Right.
So if I go to the principal's office and say, I've got a kid in my class that told me this, and they say, okay, I'll make that call, I have a responsibility to go back and check that they actually did, because sometimes they lie.
Right.
And they don't want to make the call because they don't want to deal with the publicity issues.
Right.
But I'm still a mandated reporter. And the state doesn't want 10 teachers calling from the same school on the same kid.
Right.
So that there's a reporting hierarchy.
Right. Although they do want to hear from the person who heard it.
Yes.
So I did social work at a hospital, and oftentimes nurses and whatnot would call me to hotline what they had experienced or witnessed. And
But the hospital will also have rules about who's
well,
supposed
that was but it was not with the state. They were like, "Why are you calling me?
Right.
I want to hear it from the source."
Yeah.
So,
And so can we change? We got to end in just a minute, but I wanted to ask you a question. You and I have had a kind of a cursory conversation about this, but I wanted to hear more about it on camera. What is your feeling about cognitive behavior therapy working with children?
Yeah, so I have a lot of feelings about it. I think that cognitive behavior therapy is very useful and an important foundational skill for therapists to have, but kids who are not coming to therapy voluntarily, cognitive behavior therapy based on the idea that people are having cognitive distortions or irrational thinking is basically saying, hey, guess what? Your thoughts are wrong. You didn't ask me, but I'm going to tell you. So being able to offer up alternatives to their thinking when it is welcomed, but also knowing that it can be invalidating for kids and adults if they don't come to you and say, I'm having these thinking problems, or the equivalent of that statement, then telling them what their thinking errors are is insulting to some degree, and it's kind of confrontational and is not the method that I think is most effective.
So for me, I'm really into language and therapies and things like that. Brett says, "Oh, I'll just do what works," and whatever. So he's not as pedantic about this particular issue. But so if it's not cognitive behavior therapy that you do, what would you define what you do as?
So I would say that it's relational building, and that the relationship in of itself is therapeutic and healing.
So humanistic?
Except for, I'm not quite so Pollyanna-ish as maybe some humanists, but yes, that people are doing the best they can, and that I'm going to walk with you. I'm not going to, somebody had said the other day, don't do it for them, don't do it to them, do it with them. And so that's what I'm trying to communicate to the kids, is that I'm going to give you an experience. I'm not going to say what all the other adults are already saying. What can I give you that they aren't? And so that might include some CBT, that might include some...
Sure. I mean, you might do anything, but for you then, you believe strongly that the therapeutic rapport itself is therapeutic.
100%.
Yeah.
Now, the rapport has to be there, but then the reality testing also has to be there.
And the relationship allows for that opportunity to say, and they can hear it, is that, okay, you don't say these things often, you don't. So when I do challenge them or say, you know me, I'm not going to be the one to tell you what to do in this situation. It's warranted. And so sort of intensity levels and kind of playing with the
Well, as we
volume.
were saying to Mike just before we started this podcast, how's that behavior working for you?
Right.
What happens when you behave that way? How do other people react? Is that what you want? Is that affordable? I used to talk to my patients all the time about emotional economics, and I would say that every choice you make has a cost, and every choice you make has a payoff. So you have to figure the emotional economics. Is it worth what it's costing you?
Absolutely.
If it is, fine. If it's not, let's figure out a different behavior.
Right.
So to land the plane, we've talked about between the three of us that this is a lot of, there's that duck.
Sorry.
I'm so glad that the duck is here. I miss the duck when he's not here. Working with children, and specifically people who don't have a lot of resources but need a lot of care, is oftentimes frustrating because it is necessary but is difficult to be able to find the resources to cover. And it can be really frustrating for people who are working in that area, and it can be frustrating for people who want to try and improve their situation but don't see the ability to be able to access the appropriate professionals to be able to do that. So I will include Carrie's information and some other information in the show notes for anybody who feels like that they would like to access some resources but doesn't know how to get that process started.